This is an introduction to the new release of the NeuroNavigator that's inside of NeuroGuide version 3.0.2 that was recently released. This is the NeuroGuide demo. This is a patient that had been assaulted and with a bat to his right parietal region. This is a patient that I personally dealt with when I was at the Bay Pines VA Medical Center. He's considered a traumatically brain injured patient that was also in litigation. And in any case, he was paralyzed on the left, had spatial neglect, could not write on the left side of a piece of paper. He was a very intelligent individual with no left hemisphere damage, but the CT scan was clearly evident of a right parietal damage. And you can see slow waves in the right parietal region here. I have imported his EEG. I've selected artifact-free data. You can always, and this is always recommended, save your edits and then clear your selections and then make an independent selection. And do that 2 or 3 times to show that you're going to get the same clinical interpretations no matter what you select, as long as it's artifact-free. For example, the Z-scores in the right parietal region are 4.61, 3.22 right parietal and central, and right posterior temporal and right temporal lobes, left hemisphere is okay. The FFT is in the upper right. Retest reliability is 0.97. If you repeat this, you should get 0.95 or higher. Often it's 0.97 and 0.98, etc. That shows you that you get good stability, that artifact is not prevalent. And then you always visually scan and make sure that the selections are representative of your patient. I'm not going to spend a lot of time on that, but there's other videos that do that. You can also double click the Laplacian and also generate analyses just with your linked ears and get a view of the deviation from normal in the right parietal right central region where he was injured, as well as the coherence at the surface is decoupled with blue, meaning it's reduced connectivity. You can look at the Laplacian, which is the current source density at the scalp surface, in which you're looking at currents traveling at right angles through the skull. Again, you see the right parietal, right temporal regions are deviant from normal at the same frequency. It's a good idea to move your mouse over the labels and right mouse click and produce hypotheses about which regions of the brain are likely to be deviant from normal in terms of the Brodmann areas you're going to be looking at before you launch the SW Loretta or the regular S Loretta or the Key Institute. That way you're doing paired comparisons and not multiple t-tests. In this case, we know based on the CT scan the parts of the brain and based on the symptoms that are deviant from normal in this individual. So we're ready to launch the Navigator. And to do that, you click Analysis, Navigator, and then Generate Navigator. You can do that with the raw scores or the Z-scores. In this case, I'm doing Z-scores. It's a good idea to do both so you can evaluate the various things in the brain that may or may not be deviant from normal. So I've already launched the Navigator. I'm just going to expand it now. The default comes up like this, where you have a forehead modeled with the axial, coronal, and sagittal sections. You also have the scalp potential that you can see here. You can just look at the full screen. You can look at just the axial view or the coronal view, sagittal, or the volume view. So you got just the volume itself. And we can change the transparencies of these various surfaces. The 3 view, like the Key Institute. The 4 view, I just showed you all slices, which allow you to go from deep in the brain. Here's the cerebellum, all the way up to the top of the cortex. You can then also, this view is what you will see in the automatic clinic report writer, which gives you the all slices from deep in the brain to the top, as well as the 3 standard Key Institute slices. But I'm going to go back to the 4 view. I'm going to then exit the full screen. On the right, you can see the Brodmann areas that are all active. You can sort them by center values, maximum to minimum, left hemisphere, right hemisphere, or by number. You can see the right hemisphere is deviant from normal, whereas the left is not. There are also networks such as the addiction networks, anxiety network, attention networks, default network, executive network, salience network, the diffusion tensor imaging networks of Catani and Deschatten are here, the DTI. And we'll be going through those in a second. Also the Hagman hubs, there's 6 Hagman hubs. They are in here as well, including the diffusion tensor imaging. And then the interconnectivity networks by the Human Brain Mapping Program published by Laird et al. In 2011. They summarized 30,000 PET scans and functional MRIs. Those are all in here. They're also in the Connectome publications. And all of these networks are based upon functional MRI and PET and neurological history of such as penetrating head wounds, strokes and tumors, etc. Not EEG, but rather the Human Brain Mapping Program and the Connectome program. And in addition, there are symptoms that these are based upon. Essentially, you identify the most troublesome symptoms of your patient, and then select one that is most troublesome. That will branch to the most likely network. And then there are diffusion tensor imaging bundles. We have a few in here now. We're going to be adding more that are based upon the Connectome and the Catani and Deschatten Atlas. There are so many of them, it's very important to be selective. So I'm going to go back to over here to the Brodmann areas so you can see them all. And we have shifted things a bit. I'm going to go up to 5 hertz because that's what we saw as the most deviant from normal. And so you can change frequency, you can change navigation locations, you can navigate by moving the cursor around. You'll see the values in this lower right corner for what the values are underneath the cursor, as well as at the top where you have the Taylor Atlas coordinates, which Brodmann area, in this case, Brodmann area is 7 right, a z-score value of 3.7 at 5 hertz, etc. Now we can open up our settings panel over here, what allows us to navigate. Here are slices that we can use to look at the axial, coronal, and plane and various slices. I'm going to change the scalp recording for a second and get rid of the scalp so we can look inside the brain in more detail. And then we can navigate through the brain now using these navigation tools where we got the coronal, sagittal, and axial slices. So for now, I'm going to get rid of the coronal and the sagittal so we can just look at the axial slices. I've activated the diffusion tensor imaging, which we can view by making the cortex transparent. Or you can just get rid of it by deselecting it. And here's the diffusion tensor imaging images or fiber bundles that you can see in the plane that we can move around. We can also move the axial plane up and down manually. We can go to the volume view and examine the diffusion tensor imaging fiber bundles. We can select and deselect fiber bundles. And like I said, there's going to be many more in the future that we're going to link up with functional and effective connectivity, which we've already done, but we've done it with tubes linking spheres that represent Brodmann areas. So I'm going to reactivate the cortex, make it a little transparent so you can see through the cortex. We're going to go to the networks, and I'm going to activate the functional and effective connectivity. And look at the center voxels. And this is for all of the networks. I'll make the cortex disappear so you can see all of the network hubs. The scaling for the hubs and for everything is here. To click scale, you can scale the current source density. It's between 2 and 3 standard deviations. That default setting you can change. When you launch the Navigator, it will retain your previous settings, but you can have your own default settings. Here's the settings for the Scout. It's 2 to 3 standard deviations. Connectivity, I've set all the way to 0 to 3 standard deviations so you can see all of them. For example, I'm going to look at the addiction network and the anxiety network. Here's the addiction network. Here's the anxiety network. You can go back to objects, get rid of the axial slice. If you want to know which Brodmann area this is, hold down the shift key, then right mouse click. That's Brodmann area 10 left. That's Brodmann area 10 right. Brodmann area 13A, anterior insula. And Brodmann area 21 right, etc. Put your mouse anywhere on the screen, right mouse click, and you get rid of them. If you want to look at the labels of the center voxel, you go over to your objects panel here, click central label, and now you have the labels for all of your Brodmann areas. We can look at the dorsal attention network. You can see how it registers with the diffusion tensor imaging fiber bundles. And these are z-scores. These are deviations from normal in the connectivity network. If you want to look at different aspects of connectivity, you go over to data type. In this case, we're looking at information flow, but we can look at instantaneous coherence. You can see the coherence is low, that's why it's blue. The values of the z-scores are down here in the lower bottom. The values for the connectivity, in this case it's coherence, or for the current density on the surface of the cortex, it's in the lower right. You can see there's some elevated coherence up here. It's probably around 2.3 standard deviations. We can look at lag coherence, which is the coherence where we removed volume conduction. And you can see in that particular network, there's nothing that's significant in the lag coherence. When you go back to the dorsal attention, I'm going to click phase differences. This is differences essentially in the phase delay and timing and degrees, but these are z-scores. Again, this is the attention network. Here's the executive network. Now I'm going to look at phase slope index, which is the magnitude of information flow. So there's a functional connectivity with coherence, lagged coherence, phase differences, and then there's effective connectivity, which is information flow, the magnitude and direction of information flow. Right now, this is just the magnitude. You can look at the language network in the left hemisphere. Go back to objects. The data type allows us to control whether we're at the surface, we're looking at the Laplacian or the scalp potential, the theme, and I'm going to go back here and activate the cortex. So you get some landmarks, and even go to the foreview, and under theme, you can look at it as white, gray, or dark. Dark, it allows these nodes to be seen a little bit more clearly. We may change the nodes to white or something, but right now they're purple. And we can look at the scale, as I showed before, to be able to change the range you're looking at, both in raw scores and in z-scores, depending on what you're looked at. And then for navigation, right now we're going to be jumping to the maximum center voxel as we change frequency. So, for example, at 6 Hertz, the maximum center voxel is Brodmann area 1 right, with a z-score of 3.9. At 5 standard deviations, it's Brodmann area 7 in the parietal lobes. It's right here, with a value of 4.338 standard deviations, you can see here, or in the lower right. You can have a fixed point and then go through a movie if you wish. In this case, let's just fix it at Brodmann area right. I'm going to go to the top menu region, click play. I got 500 millisecond delay between frames, and we'll start going from 1 Hertz, and I'll look at the volume view up to 30 Hertz. And there's nothing significant above about 6 or 7 hertz with this individual. You can click stop, but it's a good way to get a quick view of which regions of the brain are deviant from normal as a link to the patient's symptoms. You can also get different orientations if you wish with this control. You can control the speed at which your mouse will move the objects or the views. If we come back up here, we can look at the connectivity by selecting connectivity and then the center voxel, which we've done, and making these various other images transparent or not allows you to see in greater detail the various aspects of the brain that you may be interested in to link the patient's symptoms to the patient's brain and dysregulation in the patient's brain. So I'm going to look at attention network, which is a deviant from normal, and at least this patient's symptoms are one in which there's serious problems with attention. I'm going to make the cortex a little bit more less transparent. Bring in the skull, change the wheel. By moving the wheel, you can change the size. I can make the head a little bit more less transparent or more transparent. So these controls are very good in being able to evaluate the different aspects of the patient's brain, from sagittal to coronal. And if we make the head a little bit more or less transparent, we can go right through the brain. Just hold the mouse down on one of the navigation controls and step from the back of the brain using the coronal slice control until you get to the front of the head, and then you can reverse and go back and etc. for any of these planes. So it gives you a view, and the coordinate system changes as you do that. We can go back to 4-view to reestablish our coordinate system and go back to the volume view. And I'm going to get rid of some of these things so that we can look at them in more detail. It's good to have a slice, kind of gives you a reference point for things that are not that may be interfering with your view. And so we can look at the executive network. We can get rid of everything except the DTI by getting rid of the connectivity, the functional connectivity, and the slices. And then we're now looking at the DTI. It helps to have a landmark. So I'll bring the cortex back in so you can see where we are in the brain. You also have arrow key controls, so you can just rotate the brain as much as you want just by holding the key down. You can look at it in this view. Etc. So there's a lot of navigation controls that you have to be able to look at the brain, look at the scalp, look at the various surfaces and slices, look at the electrical potential at the scalp, and navigate through the various aspects of this as you wish. And I'm going to go to data type. And back to the foreview. So you have a lot of different navigation controls here. You can link symptoms, networks to Brodmann areas, evaluate each of the Brodmann areas, sort the Brodmann areas to greater or lesser values, and you can also export to tab limited files that you can then import into other programs. And this way you can link patients' symptoms and dysregulation to different regions of the brain that are deviant from normal. So this is a quick summary of the NeuroNavigator that allows you to link any patient's EEG that you can import from 45 different amplifiers. You can look at the raw scores. The raw scores are especially good for gross pathologies, epilepsy, spikes, and waves, sharp waves, or anything that is suspicious from the EEG. It gives you then an idea of where those deviations from normal are. And you can then link patient symptoms to dysregulation in the brain, and based upon the severity of the symptoms. And when you have, if you want to do neurofeedback, you go to export, and you export the .so5 file, which goes into the NeuroGuide Loretta Z-score neurofeedback. This particular NeuroNavigator coordinate system will be in the NeuroGuide Loretta Z-score biofeedback program. It's based on what's called SW Loretta that allows you to weight the depth of the sources and is very accurate in comparison to regular Loretta because it gives you depth with a homogeneous lead field. That's discussed in our webinars in more detail. So give you an example of what you can see for the cortex this particular control up in the upper right determines the depth. So you can go to the deep source locations. You can go to the surface locations through the cortex and get a good view of how deep the sources are. And that's unique with this 12,270 voxel SW Loretta. And in the future, we are going to be looking at the cerebellum, looking at sources, doing experiments with the cerebellum. You can see the left and right lobules there. The vermis of the cerebellum is here. And we're going to be looking at left and right limb movement, leg and arm, and balance changes to try to verify the source changes inside the cerebellum. And that would be useful to be able to evaluate balance problems and various issues dealing with the cerebellum, and also be able to then have a more complete view of the problems that patients may bring to you. In addition, we're going to be looking at sources from the habenula, which is very important for reward evaluation in life. When you do have an act that does not lead to a reward, then the habenula becomes active and suppresses dopamine. When you do have an action that predicts a future reward, then the nucleus accumbens activates dopamine. And dopamine modulates and changes the size and number of synapses. And so learning happens by virtue of these systems. In addition, the subthalamus is an area that we're going to be looking at for action control, for hyperactivity. And so these are going to be in the future. And so I'm going to give you a heads up on that. And we recommend that you play around with this. It's inside the NeuroNavigator. It's inside the NeuroGuide demo. And even if you don't purchase a Navigator, you can play around with it, learn about how to link together EEG with structural and functional aspects of the brain. So thank you for attending.